presenter today. It's Michael O Donovan. I've known Michael for many, many years when we were both at the Human Sciences Research Council. He is a data scientist, a demographer. He's a political analyst. Many of you might have seen him on SABC during the elections. And his focus is really on utilizing data science to analyze large socioeconomic and political databases. And also his focus is quite broad. We work with Michael in a number of different areas, from the development of methodologies to develop sample frames for small, medium enterprises, through the conducting of crime research, poverty, inequality. So there's a broad spectrum of areas where Michael applies data science and his experience and qualifications in South Africa. And Michael has been, analyzing the COVID data from various views since the pandemic started. So I'm going to just ask him to give us his presentation. I'm just going to stop presenting.
Right. So let me get straight to it. Several weeks ago, on July 24, we did a turning point in the COVID epidemic. From that day on, the number of infections stabilized and then stopped growing exponentially, and then started and has continued to decline. So this was the moment we were all waiting for the COVID, that turning point where the curve starts to flatten. So it seemed like there was finally this light at the end, sorry for the typo, of the tunnel. But even so far, there's only been muted commentary on the changing state, and very little media coverage highlighting the extent to which the situation has changed. The state and the Command Council, etc., have been far more diligent in asserting the positive aspects of the trajectory. So, for example, the yesterday released stats showing that the infection rate amongst health workers is only 5%, half the global average. Amongst health workers in South Africa, the fatality rate has been 0.9%, very low. And this echoes stats that have been released before. The fatality rate, according to the state, amongst the general population is similarly half the global average. And the general tenor of the commentary by the government and by the state is that South Africa has a capable state that was rising to meet a dire challenge. One capable of ensuring a rigorous lockdown while sorry about all these typos, I think this is an earlier draft, while it increases capacity to meet a medical emergency. Unfortunately, reality seems to be a bit different. COVID saga has, if anything, highlighted the poverty of information shared by the National Institute of Communicable Diseases, the various departments of health, Statistics South Africa, and even education institutions. And I'll explain what I mean by that. First thing we do, we just examine the infection rate. So what this graph does, it shows that the dotted blue line is what an exponential growth of the infection rate would be. You can see that we have recently, the actual infection rate is given by the black line. And the two lines are diverging quite dramatically at the moment. So if we simply model the infection rate on the basis of the experience of places like Hubei and the like, we would have a graphic like this, where a dotted blue line would show the initial exponential growth, the tailing off, and then the flattening of the curve. Overlaid on this blue line is that thicker black line, which is the actual growth. And you can see that the actual growth of the epidemic almost perfectly matches that model. So essentially what this means is that the pandemic has been keeping to the script. It has been doing exactly as should have been anticipated. We'll skip over this. It's just equivalent for Hubei in China. So the infection rate that we are dealt with, that the state shares with us, is that to date, 1% of the population has been diagnosed as COVID positive. These has resulted in 11,270 deaths to date, a fatality rate of approximately 2%, which is less than half the global average. There have been dimensions to this that have been obvious to everybody, starting off in the Cape, then shifting off to Gauteng, now shifting to other areas. But unfortunately, what happened was that cracks started showing up in their data. Amongst the Muslim community, for example, 2% of the South African population is Muslim. And they account, by their own reckoning, 10% of the fatalities. And there's a great deal of hand-wringing in the Muslim community as to why the death rate amongst Muslims was almost 5 times the national average. So it did cast doubt on the veracity of the state's data, simply by virtue of the fact that there was nothing else to counter this information. Basically, independently collected data was showing something very different to what the state was telling us. Data released by the South African Medical Research Council shows a very similar trend to what the Muslim community was saying. So the period that we're talking about here with COVID coincides with a decline in deaths from vehicle accidents, industrial accidents, violence, murder, etc. But the Medical Research Council data can differentiate between natural and non-natural deaths. And this is what their data shows. The gray band running through the middle of this graph is a 95% confidence interval of how many deaths, how many fatalities are expected in any given week. You can see that from approximately June, the actual number of fatalities, as shown by the black line, has surged way above that the upper bounds of that 95% confidence interval. These extra deaths, as SAMRC refers to, can only be accounted by COVID. So when we're looking at the period in question, and this goes to approximately 3 weeks ago, we have, according to Medical Research Council, an extra, this is over and above the grey band, an extra 33,000 deaths in the South African population. At that time, 3 weeks ago, the official tally of COVID deaths was 1/4 of the number. So this would imply, amongst other things, that the official tally of COVID deaths is possibly not half the global average, but double the global average. Compounding this is that for the first time in decades, there was no flu season in South Africa. Largely as a result of us wearing masks and being isolated, we have not had the traditional flu season in South Africa and in many other countries. typically, the number of people that die from flu each year is around about 5,000. And this would have put us very low on the number of deaths. So what we could argue is that the actual number of deaths attributed to COVID-19 is 33,000 odd at the moment, plus the number that would have died from flu. So at one level, it seems that the data is highly questionable. Unfortunately, in trying to unpack all this data, we need what's referred to as granular data. And a quote here from an article widely published, stating that numbers can kill. It's a statement that decries the utility of fine data. So the person I'm quoting says, statistics do tell stories. And these stories that they tell are often in the line of stigmatization, stereotyping, and negative. An example this person uses was that xenophobic attitudes are derived from statistics. And in response to Alan Winde of the Western Cape's release of detailed or granular data, this person warned Winde, politicians should take heed. Good intentions do not guarantee good outcomes. Stop imagining that granular data helps. It doesn't. Stick to the protocols and the law. Statistics South Africa does not release this type of data precisely to protect people from one another. Leaders need to do the same, or the country may be divided after the COVID-19 crisis than it was before it hit. The problem with this quotation is that its author is David Everett. He's head of the School of Risk Governance and head of the Statistics Council. And essentially what he's arguing is that in order for the state to protect us from our baser selves, not from the epidemic, but from our attitudes, Statistics South Africa, universities, Command Council has to hold back on the data. In other words, to protect ourselves, to protect us from our baser selves using ignorance. It's preposterous that the head of the Statistics Council can say that granular data doesn't help. Because of the absence of granular data, we're not able to answer fairly fundamental questions. For example, did the Muslim holiday of Eid, opening of schools, the increasing of taxi capacity, did these things impact on the infection rate? Are men more vulnerable than women? What has the impact of COVID been on small towns, particularly mining towns? This attitude towards data information is replicated. So Eskom, for example, suddenly stopped producing statistics on consumption, on electricity demand. Stats SA now claims that the CPI is at the lowest level in decades. At one level, these claims are utterly implausible. Just look at your food bill. So ultimately, we've had a massive a medical impact that's far greater than what we've been told. We've had a massive economic impact, and this is really brought about by the state implementing the harshest lockdown globally on top of a recession. The slowdown has been shown in various indices, including vehicle sales, property rentals, employment levels, and the like. And it seems that the lockdown is imposed in the absence of the key idea that poverty kills. A crude estimation is that a 10% drop in gross domestic product in South Africa would correspond to 25,000 extra deaths each year. These extra deaths are obviously not those due to COVID, but arise from things like malnutrition and the resultant susceptibility to disease. For the first time in decades, metropolitan hospitals are reporting cases of malnutrition. On top of the economic slowdown is the South African government's debt levels, which were high to start off with, being heightened further by the need for massive financial support by national and local government. Ultimately, this means that our sovereign debt levels, how much we owe, how much debt the state owes, is now above 60% of gross domestic product. 60% is widely considered by the European Union as a threshold of danger. But perhaps more debilitating is the fact that it's a bad type of debt that we're entering into. These are debts these are monies that we are borrowing largely for running costs, not for infrastructure development, not for the promotion of the economy. So here's a number of lines that tell us a story of what's happened to the economy. You'll see roughly in the middle of the screen, you've got a vertical line that says lockdown, which indicates when the lockdown was implemented. You can see from the orange line at the top that it coincided with a significant decline in electricity production. That production level has returned, electricity consumption level, that has returned to pre-COVID levels. The red line is the South African USD exchange rate, which declined in anticipation of the lockdown and rose slightly afterwards. But we are still significantly below that index value of 1, where we started off. The All Share Index, for example, has almost returned to pre-COVID levels. All this kind of information supplemented by a 30-odd% decline in vehicle sales, similar declines in property rental income. It's still tentative, but massive declines in employment level indicates that we have had a major impact, a major knock coming in on top of the recession. But perhaps most important is the political impact of COVID. Largely, COVID-19 presented the president with a get-out-of-jail-free card. What I mean by this is that after lockdowns lifted, after things can start returning to a semblance of normality, any economic hiccup, any problem will be attributed to COVID. Lower employment levels will be attributed to COVID. A declining exchange rate will be attributed to COVID. So in that sense, the president had a carte blanche as to how to proceed. It afforded him and the ruling party an opportunity to restructure the economy. And they repeated this on numerous occasions. An example will be the support lent to the tourist industry amongst certain segments of the population. The desire to stimulate growth in certain sections rather than others. Problem with this is that restructuring the economy means different things to different people. So the president, with his get out of jail free card, had an opportunity to break the impasse within the ANC between the populists and the pragmatists. Or a better way of expressing it would be between those supporting populist policies and those needing to finance those policies. So we have on the side of populist policies, we would have support of state-owned enterprises. We would have certain types of investment. In order to support state-owned enterprises and the like, you need funding. That funding has to come from, probably from debt. So you have Treasury, you have the Reserve Bank on the one side of the ANC, and you have the populists on the other. In order for the populists to meet their obligations, to appease their constituency, the funding has to come from somewhere. At the same time, in the post-COVID period, we have a changing narrative from the ruling party. People will have noticed that over the last 3-4 months, there's been virtually no mention of property appropriation without compensation. Land appropriation without compensation has miraculously dropped off the agenda. The shift has been towards other things like the acquisition of pension funds, i.e. prescribed investments that need to be made by state and private pension funds. And lately, there's been a move to talking about things like the basic income grant. This changing narrative is partly a product of the need to approach the IMF, the World Bank, for low-cost loans. Commercial loans to the state typically earn a 7% plus interest rate per annum. IMF, World Bank loans typically earn interest rates of 1 to 1.1%. So it is really cheap money for the state. And it's traditionally associated with conditionality, where the IMF imposes conditions under which the loan can be accessed. This time, the conditions imposed by the IMF were very limited. And essentially what the IMF required is that South Africa holds itself to the promises made in this medium-term budget policy statement. That medium-term budget policy statement indicated the state's commitment to improving the business environment, to putting back on support for state-owned enterprises, to bringing the public sector wage bill under control. In other words, the loans of the IMF really undermine the populist dimension within the ruling party. And to a certain extent, this could be construed as being deliberate. So what we are seeing now in South Africa is hopefully a realignment of interests within the ruling party, and one in which the pragmatists, or those with fiscal responsibility, are in ascendance. So all these graphics, all these figures are available on this website. I can be contacted this on these details. That's it.
One question from Bruce with regards to whether or not the basic data can be trusted.
Well, we are presented with a conundrum here. So when at the early stages of the COVID epidemic, testing was fairly widespread, and 1 every 32 tests resulted in a positive diagnosis. With time, that has been pulled back dramatically and has become increasingly difficult to be tested. Currently, 1 in 4 tests conducted results in a positive diagnosis. But the simple model I have produced there is matched virtually perfectly. The thicker black line is on top of that blue model. And it's almost as if it's too good to be true. Can things really be that simple? So I for one, am very skeptical about the data. It's as if the data being released is designed to match that model.
In terms of your modeling and the way you've been looking at the data, do you foresee that we have hit our peak and that we are flattening out now?
Okay, so the word peak has been used in 2 different ways. The peak, in the way I use it, is when the largest number of infections take place on any given day. And that peak, which I think was approximately 14,000 infections on one day, took place 3 weeks ago. Since then, the curve has been flattening to the extent that by early November, we would have reached what other people refer to as the peak. So let me carry on and say that our peak is in November. And that is used in the context of when the maximum number of total infections has taken place. So the models are the same. The largest number, total number of infections will always be at the later date. Total infections are cumulative, and they will peak sometime in November, and they will peak when nobody else becomes infected. And I think this is a stupid way of using the word. Peak is when people are most vulnerable, where the number of daily infections is maximized. And we passed that 3 weeks ago. So we are in a situation now where the curve is flattening rapidly. And we can see the end of this with a total number of approximately 660,000 infections in the country. And everything should be back to normal early November.
Here where I live in Ireland, we were very strict in our lockdown, and in the country as a whole, which is a population of just under 5 million people, we were getting about 7, 8, 9 new infections a day. We're now up to 70, 80, 90 a day. So we had thought that we had pretty much covered it. There were still restrictions in place even when we were low, but there's been spikes again. The county that I live in is now in almost full lockdown again. So the point I'm really making is, I think you just need one person in a society to remain, influencing other people.
So in the presentation, I provide the statistics for Hubei province, where Wuhan is located in China. And if you trust the data, is that once that curve flattened, there were no more infections. In other words, that the spread of the disease was totally controlled by social distancing, wearing of masks, rigorous monitoring of buildings, in the context of a competent and powerful state. But I think we need to draw a distinction between the economic impact of a lockdown in Ireland or New Zealand or any country where with a healthy social welfare system, as opposed to one in South Africa where you have, by various estimates, 30–40% unemployment, massive level of poverty, where the state support for those is very limited. I think they're talking about 500 Rand a month. So it's in that context that the impact of malnutrition and other levels of deprivation cannot be ignored. So, and the scenario I present is that, is it better to have 25,000 deaths from poverty or a far smaller number from COVID?
Michael, just a question. I mean, a couple of points that I'd like to just get your opinion on in terms of your presentation. I mean, I get this perspective from the statistics that you've presented that South Africa is not any way different to any other country in the world in terms of how this epidemic has progressed. You know, at one stage, when the fatality rates consistently remain very, very low, and the reality being is looking at whether there are factors in the South African environment which makes us special. And in essence, what you're saying is that South Africa is not special. You cannot anticipate that our fatality rate, based on all the things that you've looked at, would be any different to the rest of the world. What's your thoughts on that?
Well, if we had the granular data, we could possibly answer the question comprehensively. But at the same time, everybody else thought they were special. If you recall, India thought it was saved from this. People in Gauteng thought they were saved from it, and it was largely a function of what was happening in the Western Cape. South Africa thought it was safe from it because of our vaccine protocols. So we had a great deal of discussion and narrative based on, essentially on wishful thinking. The only way to answer all this stuff is actually by using the data. So it would be appropriate. Okay. COVID-19 is not a once-off. It will be a matter of years before a similar and perhaps even more virulent epidemic takes place. Was the solution the using of masks? Was the solution allowing taxis to be 70% full? Was social distancing the question, the answer? It's only by getting that data that academics can objectively answer those questions. So, in short, no, we're not special. We do, however, seem to be misrepresenting the impact of death and COVID. And I think this is going to haunt us for a long time to come.
Would it be fair to therefore say, based on what you're saying, is that government is not really acting in good faith to the citizens of this country by the fact that they are not providing this granular data to us?
Well, I personally found it a lot more destructive where, if you take David Everett's comment, basically where he's saying that it falls to the state to make sure that I do not think ill of other people based on data. So the example he uses is that data regarding crime resulted in xenophobic attitudes. And by implication, that if you want to reduce the level of xenophobia, don't provide that crime data. So how do you protect us from our baser selves, from our stereotypes? By keeping us ignorant. The mind boggles. Open data and open software are really what equip us to answer these questions, and if the questions aren't answerable, to raise the questions. Apparently they have a magnificent information center at the CSIR, which presumably has been keeping people in power informed. But I see absolutely no benefit to the other 59 million people in the country.
Thanks, Michael. Just 2 comments on that. The first one being is that you and I wrote a paper in the Daily Maverick, and I had a response from a guy from Tanzania who sent me a paper on the international protocols that South Africa are part of. And that international protocol says that every single citizen in the world has a right to have sufficient information in order to protect themselves. From that particular perspective, I think that we have not done well in the South African situation. From all that you have said in terms of the medical aspects, in terms of the economic aspects, and even the political aspects, as an individual citizen, what does this mean to me? What should I be thinking about in the coming weeks, in the coming months?
It's a nuanced question in the sense that there's, okay, so speaking for myself, right? My optimistic side indicates that perhaps this is breaking the political impasse in state leadership, and that emerging from this, from the ascendance of the pragmatists within the ANC, that perhaps the economy can open up again and can be stimulated. On the medical aspect, the trajectory of the pandemic seems to be totally independent of any decision made. There have been no changes in the trajectory of the pandemic when taxis were allowed to go 100%, when cigarette sales were banned. There have been no apparent cause and effect that would impact on the wider trajectory. So ultimately, what people really need to do simply is wear masks, social distance, and put all your effort towards saving yourself from the economic collapse, which is going to be far more detrimental.